these changes happen gradually over time. They don't feel it, they don't notice it. We are able to look non-invasively inside the eye and get an idea of how well the body is reacting with its blood circulation.
When we talk about diabetes, most people think about diet, exercise, or medication. But what doesn't always come to mind is how closely diabetes and eye health are connected. Hello, and welcome to Visionary Voices in Optometry, a series by the Ontario Association of Optometrists, where we explore the stories and the science behind healthy vision. I'm Mark Donison, CEO of the association. Today, I'm joined by Dr. Nima Tajalli, a practicing optometrist and an OAO member. Join us as we talk about the role eye care plays in living well with diabetes. Dr. Tajalli, thank you so much for joining us today.
Pleasure.
It's great to have you here. And while we are just going to jump right in, why don't we start with having you introduce yourself a little bit and let us know a bit about you and then how you got into optometry.
Sure. So I'm Dr. Nima Tajalli. I'm an optometrist. I practice in Ontario. It's a pleasure to be here. Thank you for inviting me. So essentially, I got into optometry. It started in undergraduate school. I went to the University of Western Ontario. I was studying health sciences at the time. And in my senior years, I was looking into exactly what health profession I wanted to get into. And one of my classmates, she was going into optometry school. And so as I investigated more about what optometry is, the future of optometry, and the work that we provide, I decided that this was a good fit for me. So I decided to apply to optometry school. I actually went down south. I'm a snowbird. I went to Florida at NSU. It was a great opportunity, great experience. I learned a lot. I was very fortunate to have some great professors, great teachers, great mentors. And after I completed my studies, I decided to come back home.
So thanks again for joining us today. And we're going to jump into some of the topic here around diabetes and diabetic retinopathy. So we're going to explore your expertise and knowledge about the topic and learn about this important topic. So we're going to jump right in then and talk about some of the basics. So how exactly does diabetes affect eye health?
Right. So that's a great question. It affects the eyes in numerous ways. In its more basic way, it basically affects the functionality or how people perceive things. Basically, things become blurry. And so when people have blurry vision, if they wake up one morning and they can't see as clear, and it becomes very alarming to them. So once the vision becomes blurry, they need to get their eyes checked because they're saying something's off, something's not right. And so one of the ways it'll affect their eyes is by causing this blurriness, which translates into what's called diabetic retinopathy.
So tell us more about this term and what is it and why is it such a concern for people with diabetes?
So diabetic retinopathy is basically a vascular condition. So inside our eye, we're very fortunate, it's rich in blood vessels. And these blood vessels provide oxygen and nourishment to a tissue called the retina. Now that retina is so important because without that retina, we wouldn't be able to see anything around us. So if the blood vessels become impacted, they become impacted by becoming more leaky. They start to leak, they start to bleed out. And unbeknownst to people, these changes happen gradually over time. They don't feel it, they don't notice it. And then eventually it starts to distort their vision and things become blurry.
So when you say it starts to get leaky, and so what is actually happening inside the eye?
Yeah, so essentially what's happening is as the glucose in our body fluctuates, and that's essentially what's happening with diabetes. So in diabetes, people's glucose is now spiking too high. And those fluctuations in glucose start to impact the blood vessels or the integrity of the blood vessels throughout our body. And that's one of the beauties of optometry and the beauty of eye health is that we are able to look non-invasively inside the eye and get an idea of how well the body is reacting with its blood circulation. And so once we look inside the eye, we can see if there's these little microaneurysms, which you can kind of think of it like a balloon. You have a balloon, you blow air into the balloon gets larger and larger and larger until it pops. Once the balloon pops, that's the hemorrhage. So whether it's a hemorrhage, whether it's a microaneurysm, or whether it's leakage, which is caused by that description I mentioned earlier, this can affect the tissue and affect our vision.
And why is this condition often referred to as a silent disease?
So there are plenty of people that are able in early stages to see 20/20 vision, and their glasses are working fine, their contacts are working fine, or even uncorrected, they're seeing 20/20, but there's changes gradually and slowly occurring within the eye. And so if they're seeing 20/20, maybe right now they're not symptomatic, but down the road it can become problematic and they could lose their vision without knowing. That's why it's called a silent disease. If you have diabetes, you should be getting your eyes checked because these changes in your eyes are an indication of changes that may be happening in your body. So it's very, very important.
Let's sort of leap forward and say someone has been diagnosed with diabetic retinopathy. What treatment options are available for them today?
For sure. So when we talk about treatment options for diabetic retinopathy, it's really important to kind of break down, without going into too much detail, the types of diabetic retinopathy. So in a very basic level, there's non-proliferative diabetic retinopathy and there's proliferative diabetic retinopathy. In the non-proliferative diabetic retinopathy, what happens is we have mild, moderate, and severe stages. So in people who have non-proliferative diabetic retinopathy, those changes we want to closely monitor because we have to work as a team with family physicians, with endocrinologists regarding what we are seeing inside their eyes. Because what we see inside the eyes may be an indication on how well the diabetes is being managed, how well the medications are working. So if someone has non-proliferative diabetic retinopathy and we start to see that it's progressing from mild to moderate to severe, then the endocrinologist or the family physician may need to tighten that regulation with regards to the blood glucose. So they may add a medication, they may add dietitians, they may add lifestyle changes to really say that, listen, based off this eye exam report, the diabetes in your eye is progressing. We need to take a more close look at how well your sugar is being maintained. And now, thanks to technology, there's actually continuous glucose monitors that diabetic patients have that sticks to their arm and sends 24/7 on their smartphone what their glucose readings are. So they're better able to manage and see what snacks they should touch, what snacks they should not touch, what time of day they're eating, things like that. So tight regulation will help make a difference with regards to what we see in the eye. If we spread and go to proliferative diabetic retinopathy, now we're talking about a whole new ballgame. In proliferative diabetic retinopathy, the eye and the brain are very smart. The eye is saying, I'm not getting enough oxygen. I need more oxygen. So it says, let's make new blood vessels. And how does it make new blood vessels? By basically creating what's called neovascularization. And if neovascularization occurs, that's when the eye says, I'm now making new blood vessels, but these new blood vessels are not proper. They're leaky. So if that happens, then treatment becomes laser. Laser PRP is when a vitreoretinal surgeon or a retina specialist will go ahead and laser the back of the eye because those blood vessels are now proliferating, hence the name proliferative diabetic retinopathy, to stop that proliferation from occurring. If someone develops diabetic macular edema, that can occur regardless if someone has proliferative or non-proliferative. Diabetic macular edema, which is a long term, I know, basically means that there's swelling, there's fluid leaking in your macula. And your macula is important because it allows you to basically see that 20/20 vision. If someone unfortunately develops diabetic macular edema, that treatment includes injections in the eyes. So when we talk about treatment for diabetic retinopathy, fortunately with today's technology, there's a series of tools in our toolbox. Those tools can include injections in the eyes, which are called anti-VEGF injections. They can include steroid injections. They can include laser photocoagulation. They can include laser 360 PRP, and they can also include vitrectomy. So a lot of different treatments, but regardless, the most important thing is to get your eyes checked so we can see if there's any changes, so we can work with your family doctor, work with your endocrinologist, and work with your retina specialist to make sure that every person gets the care they need to be proactive and not reactive.
And so the way that you're describing it, it leads to this view that there's damage occurring to the eyes, right? And
Mhm.
so can vision be restored, or at that point, if it progresses too far, is it really about treatment and preventing further loss?
Yeah, that's a very good question. I get this question asked quite often in my practice. And so what happens is if there's early detection, then hopefully we can preserve the vision. Now what happens is that it can't always be restored. And again, this is very case by case. So it's very individualistic in terms of what case we're talking about. So that's why we do have certain technologies such as the OCT, whereby let's, for example, go to a case if someone has macular edema from the diabetes. Oftentimes, if someone has diabetic macular edema, if it involves the center of their macula, then they will get anti-VEGF injections. And sometimes those injections will occur every month, depending on the severity of it. And if it's done efficiently and sufficiently in time, then we can preserve the vision. But if there's damage done in certain areas of the macula, then sometimes it's non-reversible, but hopefully we can prevent it from going to the other eye or prevent it from spreading throughout that same eye.
Okay.
So
Yeah.
there's still lots of good things to be done as long as we're getting those eyes checked and picking it up early enough.
Okay. So we've delved quite deeply into diabetic retinopathy,
Yeah, we have.
so, which is fascinating.
Yeah, we
right?
dumped into the ocean, straight into the ocean.
Before we go deeper,
Yeah.
what other eye health conditions should we be aware of related to diabetes?
Okay, so there's a whole list of things. Just to keep it very light, there's also, for example, people are surprised to realize that when they have diabetes, they can also develop cataracts. And that's because the diabetes, their glucose is going unchecked, and now it's affecting the lens, creating cataracts in their eyes.
It's fascinating.
Yeah.
It's quite something. Eh?
Yeah.
So we've talked about the science a fair bit. Let's shift gears and talk a little bit about the people side of things here.
For sure.
And so we started talking a little bit about ages, but who is most at risk of developing diabetic retinopathy and other diabetic eye diseases?
So essentially, people with diabetes naturally would be more at risk of developing diabetic retinopathy. So anybody with diabetes, yes, you have a risk of developing diabetic retinopathy. But also if you have high blood pressure, high cholesterol, this can also put you at risk for developing diabetic retinopathy, the ABCs as I call them. And this is because, as we all know, blood pressure can affect blood vessels. Cholesterol can create atherosclerosis or plaques building up in our blood vessels. So the commonality between diabetes, high blood pressure, cholesterol, or dyslipidemia is its impact on the blood vessels. And since these blood vessels are very important to our body, they're just as important to our eyes.
As we look further down that path, we talk about how to deal with all this, right? And so part of what people with diabetes faces is sort of a lifestyle change, right? And so what's your view of the lifestyle changes that can help in preventing the problems with people's eyes?
Yeah, so great question. So with regards to lifestyle changes, as you mentioned, sometimes weight, okay, obesity can also be a factor, okay? So when we talk about body mass index, okay, people with higher body mass index, this can be a risk factor for developing diabetes and a risk factor for diabetic retinopathy. So lifestyle changes would include diet, exercise. This is very important. But something that's not really talked about that I find that is important is actual stress management. So there are a lot of people that are working very, tense jobs, 9-to-5 jobs, or overnight shifts, things like that. And I see it quite often in my practice as well that people that work late shifts, they're staying up late, they're not getting enough sleep. That's affecting their diet. That's affecting their glucose. That's affecting their lifestyle. People that are under lots of stress. If you're under lots of stress, your body's going to go through that fight or flight response. Your sugar will spike up, and all of a sudden you can start to see changes in the eye. So I would say lifestyle modifications would include diet, exercise, maybe meditation, stress management, and really trying to get a good night's sleep as well. Sleep is a very, very important factor as well.
Life's busy.
Yeah.
People have lots of concerns these days, and when you try to cut through all of that, right? And so, what would you say is the one thing that people living with diabetes today could do to protect their eyes?
Yeah. So, very important point, get your eyes checked. Okay. If you have diabetes, we're very fortunate in Ontario, whereby the OAO and the Ontario government have done a good job at reiterating the importance of diabetic eye examinations. And so, irrespective of age, if you have diabetes, there's an opportunity for you to get your eyes checked, and you should get your eyes checked.
So let's build off that a little bit. So we're going to
Sure.
get into detection and exams
Sure.
and the accessibility to eye care in
Sure.
Ontario. So what are some of the early warning signs that diabetic patients should never ignore?
Great question. So, fluctuations in vision. Okay. So, sometimes people notice that all of a sudden I was seeing great, but for the past week, something's off. I can't see as clearly as I used to. Yeah, that could be just a simple condition where your eyes just need a pair of glasses, which we call presbyopia, or it could be something more severe. And so, as I alluded to earlier, if your sugar is fluctuating, that can cause fluctuations in your prescription for glasses. So, people unknowingly assume that they just need a new pair of glasses and they keep purchasing new glasses, new glasses, new glasses without actually checking their glucose to see if it's within normal range. So, those fluctuations in sugar can cause fluctuations in your prescription. So that's something that they should be aware of is if I'm having this intermittent blur, sometimes on, sometimes off, get your eyes checked. If I'm noticing that lines, which once looked straight, are now crooked or bent, get your eyes checked. If things are glare, halos, glare, things like that, hazy, get your eyes checked.
If someone has diabetes but they aren't having any vision changes, do they still need an eye exam?
100%. Yes. So, uh, as we discussed earlier, diabetic retinopathy is one of those silent diseases. People are not aware that they have diabetes in their eyes, especially when their vision is 20/20, but it might still be there. So, irrespective if someone has diabetes, or let's say they don't even have diabetes, you should get your eyes checked. As an example, in our practice, there's been numerous times where patients have come in, let's say they're 40 and above, they've had a clean bill of health and they're assuming that I'm just here to have my eyes examined, make sure things are up to date. No problem. We take a look inside the eyes and we find a small little microaneurysm. Well, we'll write a letter to the family doctor and say, listen, we discovered a microaneurysm in the back of the eye. Can you check the fasting glucose? Can you check the A1C? And sure enough, they're pre-diabetic. And now that one exam led to diet and lifestyle changes to prevent from going from pre-diabetic to diabetic. Because as I'm sure we'll discuss as well, when we talk about diabetes, it can have a huge impact on our healthcare system.
Mhm. And when somebody walks into a clinic for an eye exam, what does a diabetic eye exam involve? And one of the questions that often comes up is it painful or uncomfortable?
No. Yeah. So fortunately, due to technology, it shouldn't be painful. Okay. Diabetic eye exam is not a painful experience. Okay. So essentially, what happens is when you get your eyes checked, the optometrist, the eye doctor will go ahead and do a series of tests. So quite commonly, we're used to reading the letters, things like that, but it's actually far more advanced than just reading a bunch of letters. Your optometrist will look with a microscope and look layer by layer into your eye to look at the different areas within your eye and see if diabetes has impact any of those areas. Also, your optometrist will check the pressure in your eye. Your optometrist will put some special drops in the eyes, which we call dilating drops. This will expand the pupil and will get us a good opportunity to look inside the eye. And once we look inside the eye, we're able to determine if there's any changes in the retina in the back of the eye. All of that is painless, okay? And usually people are quite happy after they've had it done because they feel that they've had a very comprehensive checkup. In our practice, we have what's called a DRS retinal image, and we also have what's called the OCT. So the DRS retinal image is really a game changer. And what it allows us to do, it allows us to take a high definition image of the blood vessels in the back of the eye. So pretty much think of it as HD TV, okay? 4K, 5K, that's what we're talking about. So we're looking really nicely inside the blood vessels. And I've seen numerous times where the smallest of microaneurysms were able to be picked up with that type of technology. And so fortunately, in Ontario, a lot of optometrists have invested heavily in this type of technology, not just the DRS Plus retinal camera, which is for myself, I can't speak for others, but there's a whole slew of equipment out there. And this is why Ontario is at the cutting edge at leading diabetic eye exams. We have OCT, we have retinal imaging, we have the tools to be able to screen for these things, so we're able to take care of the people of Ontario, which is what obviously we all got in this profession to do.
Just a couple other questions on this topic. And so, how often should people with diabetes see an optometrist?
Great question. So fortunately, through the work of the OAO, that they've advocated on behalf of the people of Ontario, optometrists and people of Ontario are covered once every 12 months for an eye examination. So if you're in Ontario and you have diabetes, once every 12 months you're covered for an eye exam, and you should get your eyes checked. Now, sometimes if you have changes in your vision, you may need to be seen more frequently, and that's a conversation you will have with your primary eye doctor, who will determine if you need to be seen more frequently, and other tests are recommended to further monitor the health of your eyes.
So we're going to shift gears onto another topic. This one's about getting the word out a little bit more. So how important is early detection, not just for the patient, but for Ontario's healthcare system overall?
Got it. Okay, so very, very important. So when we talk about the cost of diabetes in Ontario, so Diabetes Canada actually put out a report, and it says that it's costing Ontario $2.2 billion for diabetes care. And so when you talk about that, yes, it's a number, but we also have to think about the person as well. This affects their quality of life. Okay, nobody wants to have a debilitation where their eyes are not functioning. Their quality of life is going to be impacted. Their ability to drive may be impacted. Their ability to do their work may be impacted. So this has a multifactorial layer to it.
We talked a lot about patients with diabetes, but tell us a little bit more about how it may happen, or how often does it happen where you're actually conducting an eye exam where you notice something and it's like, oh, there may be something off, and it actually leads to a patient being diagnosed actually with diabetes itself.
Yeah, so that's quite a great question. It's quite often happening, unfortunately, for certain people. They're coming in, they're getting their eyes checked, and we're determining that, you know what, I see a little blood spot there. I'm going to send a letter to the GP, the family doctor, get a blood workup done, have a fasting glucose done, have an A1C done, and turns out they're pre-diabetic, diabetic. Now, aside from that, there are people who come in who have diabetes. They're coming in for a diabetic eye exam. But when we do the eye examination, we're not just finding diabetes in their eye. They may not have diabetes in the eye, which is great news, but they may have macular degeneration in their eye. They may have cataracts in their eye. They may have what's called a retinal detachment in their eye. Unknowingly to people, sometimes when you have diabetes, you can develop what's called a tractional retinal detachment. A tractional retinal detachment is when the new blood vessels start to grow in the back of the eye, and like a tent, they start to pull and pull and pull. And that traction can pull the retinal right off. And so when people are coming in for their eye exam, even if it's a diabetic eye exam, they may be diagnosed with other eye conditions such as central serous retinopathy, such as glaucoma, such as cataracts, such as retinal detachment, and a whole list of other conditions. So getting your eyes checked for diabetes is very important, not just for diabetes management, but for other health management as well.
Nima, this has been an absolutely fantastic conversation.
Yeah.
Incredibly enlightening. And thank you so much for sharing your expertise and your obvious passion for this as well. Before we wrap up, I just want to open up the door here and see if there was anything else you wanted to share with our listeners today before we wrapped up.
Cheers. I appreciate that. I would just like to thank the audience for paying attention to diabetes awareness. It is Diabetes Awareness Month, and diabetes is a chronic condition affecting millions of Canadians. And I think that all of us, whether you have diabetes or you know friends or families who have diabetes, once you're aware of the resources that are available, it's important to use those resources, get your eyes checked, and always know that there are people in healthcare that are working very hard for you, and they're here to do the best they can, and that you're not alone.
It's reassuring to know that we have people like you in the healthcare system
Cheers,
looking after us.
I
And looking
appreciate
after
that.
our eyes. So
Thank you for the kind words.
thank you so much for joining us. It's conversations like this that really underscore just how important eye care is in managing diabetes and supporting overall quality of life. Thanks so much for spending time with us today. I'd encourage you to subscribe to our channel and connect with us on Facebook and Instagram so you don't miss future discussions on eye health. We'd also love to hear from you. Please share your questions or thoughts in the comments. We look forward to welcoming you back for our next episode of Visionary Voices in Optometry.